Picture this. Your grandmother is lying unconscious in an ICU bed. There are tubes and monitors surrounding her, and the only thing keeping her alive is the breathing tube or endotracheal tube lying in her airway. Then, without warning, that tube slips out. Her oxygen levels plummet. Nurses are rushing in, alarms are blaring, and for just a moment, her life seems to hang by a thread. These events, called unplanned extubations, are frightening and can be potentially fatal. Of the 3.4 million Americans intubated every year, over 120,000 experience unplanned extubations. And of those, over 21,000 are estimated to die following these events.
Even when not fatal, unplanned extubations lengthen ICU stays, adding approximately $5 billion in additional healthcare costs. These events pose a significant concern, so devices called endotracheal tube, or ETT, fasteners have been created to mitigate it. Unfortunately, failure of these devices is all too common. They can detach from the face due to the patient's oral secretions, they can fail to resist turning or pulling forces on the tube, and they can also cause pressure injuries in and around the mouth.
That's why we set out to create the Breathe Easy EndoGuard, a novel endotracheal tube fastener that addresses the failure points of previous devices. Our device features a ratcheting mechanism similar to handcuffs alongside chevron-like protrusions that enable adjustment to different tube sizes and prevents patients from pulling their tube out. In addition, it features a pivoting mouthpiece that adapts to patient movement and patient repositioning, thereby preventing inadvertent extubation during care. Finally, we feature an adhesive foam piece that attaches to the upper lip, thereby ensuring device securement while preventing patient discomfort.
Our device has been rigorously tested, demonstrating a 33% improvement in tube securement compared to the industry gold standard, while cutting the amount of pressure applied to the lower lip in half.
To bring our device to market, we plan to injection mold all rigid components using polyethylene. Since it qualifies as a Class 1 510K exempt device, the regulatory pathway is streamlined.
With our novel Breathe Easy EndoGuard, we aim to eliminate unplanned extubations nationwide.
Come find us at Capstone Expo to learn more about our device.